introduce our honor moderator, Dr. Ajima Suwanjinda, instructor in Inmode surgery, laser and dermatologic surgery at Ramathibodi Hospital. Board of Directors, Thai Costume. Everyone, please welcome Dr. Ajima Suwanjinda.
Thank you. Good morning, everyone. And I would say that it's always my great pleasure to be here and a part of, Inmode family. And this year we even bigger. Not only we have so many of the Inmode unit in Thailand, but it's actually Inmode all over the world. So I would say that I'm so thrilled because of every time that I'm here, I always learn new things, and I will, go back with some new idea, which is, challenge me to get a new treatment from my patients. So this year, today, we're gonna learn the science behind this technology by the brain of Inmode, who invent this technology and who actually behind the technology that we use, why it's so intelligent, because the guy who invented or have researched about it is so genius. And also we're gonna learn from our expert. They are the world expert on using this technology, and including we're gonna have our Thai colleagues who actually use the Inmode technology for a quite long time, and they will share with us, how to use it in Thai patients. So I'm sure we're gonna have fun in the whole mornings today, and we are going to start with Mr. Mishka, or Mr. Michael Kreindel. He actually the co-founder of the Inmode. He's with the Inmode since inception, and he will talk with us on the R&D and development of Inmode. So please welcome Mr. Mishka.
Thank you. It's a little bit confusing. Mishka is my nickname, meaning teddy bear. So, okay, I see my presentation. Inmode is a technological company. We position ourselves as a high-tech company, and we behave in this way. So we put a lot of resources in development, and development it's not only boxes or handpieces that we make, it's development of clinical applications. We are working a lot with our doctor all around the world. Company has 30 engineers and scientists. We run in parallel 17 R&D projects. We have 7 clinical studies that's running in this moment, and we support regulation in 90 countries. In addition, we have about 10 patent family protecting our technology. I will start with Morpheus. Morpheus somehow became a really popular brand. My daughter was in some business courses in Switzerland, and one of the lectures was about how young businessmen should care about themselves. And when lecturer asked the student, what aesthetic technology you know, two people said, we know Morpheus. So, and my daughter was very proud that her dad is involved in that. Totally, we are around the world performed about 1 million procedures in a year. It's not taking the account that some countries using tips multiple times. So the last development is 3D technology. It's no magic. The more energy you apply to the patient, the better result you get. But how to apply this energy with maximum safety? We have to control energy delivery to each needle. So 3D technology, it separate tips to a few circles which has different distance to the external electrode, and we control energy according to these groups of needles and according to the depth. So to deliver exactly the same energy for pulse. And with this new burst technology, during the one pulse we deliver energy to the 2-3 depths, we can get treatment much safer and much more efficient. We are working not only, as I said, on technical aspects of the procedure, but also on clinical. We now running a serious study on acne to show how what parameters works better for the patients with severe and cystic acne. We are working on hyperhidrosis, and you know that hyperhidrosis is some terms that may be applicable to 1% of population, but I don't know any young person who doesn't want to get rid of sweat on a door and spot on at the end of the day. I suppose in warm countries like Thailand, it's even bigger problem. I think treatment of axillary sweating, it should become the kind of commodity treatment for all young population. I discussed it with Dr. Achima, and she said, you know, I thought about that even before, and already working on such treatments and treating her patients. We are working, of course, on body contouring. You know, all this microneedling starting from the face, from wrinkles, from tightening of the face. But now we are very successfully treating body, especially like for post-pregnancy abdominal, which addressing stretch mark and loose skin and other aspects of the problem. And now the last but not least, we are working on cellulite treatment. Cellulite is kind of, you know, every company in the world treating cellulite, starting from massage to some warming to some maybe plastic surgeon do it with subsection of the septa, but it's really no good protocol and reliable protocol to address the cellulite. We are working in this direction, and we have some concept how to treat that. Another new direction, we started this from addressing need of kind of ophthalmologists, optometrists to treat dry eye. And we developed new handpiece called Forma Eye, and we optimized that RF doesn't penetrate deeper than 2.5 millimeter because we wanted to treat eyelids above the eyeball, and we don't want to hit cornea or some other eye structure. And in parallel, and it works perfectly. I will show that for the dry, but also it's address the wrinkles in this area. So it's no device that can safely treat eyelids, upper and lower eyelids above the eyeball. Also, we developed some adapter for the IPL, just with the same spot size. We optimize that, you know, with small spot size, we limit penetration depth, because you have, in addition to absorption of the light, you have some geometrical divergence of the light. And we also optimized this adapter to work on the same depth, up to 2.5 millimeter, to treat upper and lower lids without risk for the eyeball. But you know, for the IPL, if you treat above the eyeball, you still need to use some eye caps. This is from our study. I just did not put all these questionnaires that is, you know, less kind of reliable. I put the real measurements with tear break time in a second. So it's created some tears on the with some drops on the eye, and then you measure how fast it's evaporated. And you know, after the treatment, it's you know, dramatic improvement. It's from like severe dry eye, it's go almost to normal. The other, it's membrane gland score. So it's like when you, after the treatment, you express the sebum from the membrane gland, and you measure viscosity and transparency of this layer. You see how dramatic are results, and it's for 6 months, its results are at least remaining. And these some pictures. It's from Dr. Don in Canada. You see how the looks membrane glands before. It's like they damage, and you see some areas without them, and how nice it looks after the treatment, and how healthy eye and eyelid looks after former eye treatment. The other thing, 6 years ago, I got email from Dr. An, this plastic surgeon in Thailand. And he wrote that he did treatment with Forma for 1 hour, 50 kilojoules to patients, and he sent me picture that after the treatment, really slimming effect on the face. It's like bulky, like rectangular face before, and then suddenly it became like triangle. So of course I did not believe. I took 2 patients in the office and treat them for 1 hour. It's almost impossible. I was close to suicide at the end of this treatment. It's so long and hand-soaring, but results really were very good. 2 weeks later, I see the slimming effect. And this was basis for the development of the first Evoke device for the facial treatment, to apply RF with RF geometry similar to the Forma to the face for 30 minutes or longer. And but what we found that there is different doctors, different environment. Some spa environment that not big results, are quite good adapted, and you treat patients like every 3 months. For dermatologists or plastic surgeons, expectations are different. You want to, after 3 treatments, to see something real, because people come into doctor for results, not like to some massage. And now we are coming with a new device that's kind of station that's combined and hands-free approach and Morpheus and Forma. Because with hands-free you cannot, for example, address periorbital area, but with that you need to treat. And some patients very demanding. They want dramatic results, and doctors have to provide. So now we are going from pure hands-free model to hybrid solution. When I first was in Scotland, I just came to the pub, and pub ordered single malt. And the local guy sitting next to me said, "Why single malt? Why you not order a blend?" I said, "Why? Everyone say that single malt is better." He said, "No, with blend you can optimize the test and get something much more interesting than with single malt." So here we are switching from single malt to the blend solution, adding other hand pieces to the Evoke system, creating define. In addition, we have the different mask and also new features. Now this electrode, they have some element like moving over the face. So when you apply, and we found it's important, because when you move electrodes, it doesn't stop blood circulation. Because when you stop blood circulation, especially over the zygomatic bone or the jawline, so it's not only even, you cannot create proper inflammatory effects after the treatment. But also it's a safety issue, because when you stop blood circulation pressing over the bone, it's kind of, in this specific point, you increase risk of the burn. So this like movement of electrodes, we believe, will be in favor of both safety and efficiency of the treatment. Also, the new area that we move in, but it's slow, it's called Empower. It's a platform for female wellness. Just all area of medicine develops so fast, but if you come into the gynecology office, it looks like a medieval environment. So it's still like this metal speculum, it's doctor looking inside with the eyes, like it looks like women are ignored. And many applications that's basically not even covered by insurance and not have any solution. So we have, with device first, we focused on stress urinary incontinence, and we have very good results with that. After already first treatment, patients see results. After 3 treatments, patients have significant improvement for at least for 12 months. We have handpieces addressing different aspects of the problem, and it's pelvic muscles with V-tone and collagen stimulation, and this collagen remodeling with Morpheus V that's help to support urethra and prevent incontinence. Also, we have very good results on genitourinary syndrome of menopause, or what called before vaginal atrophy. Basically, it's post-menopausal effect that female experience and pain, dryness, and we see significant improvement of lubrication, natural lubrication after treatment. And we continue to work in this direction. For example, HPV, it's human papilloma virus. Like 90% of population have this problem, and at least American Association of Gynecology, they do nothing until it became precancerous. So, but this is disease that's so common, and women want some treatment for that. So we are working on something to treat it in early stages, not waiting for precancerous when usually it's recommended some conization or lip procedure when all this cervix cut out, and then it's, you know, already women cannot get to pregnancy and other, you know, severe problem. The other problem that we are working now is overactive bladder. It's, you know, that's with the women who has 2-3 kids after age 50. I think it's about 50% of population have, women in this situation have overactive bladder. So it's, they have to go to the bathroom like 5-7 times in the night. You see, you can imagine what quality of life they have. So we have very preliminary results, but which are very promising. We bought some patent from University of California talking about this treatment, and we are working with a few professors in America and in Latin America developing this treatment. So that's all that I wanted to share today. Do you have any questions? Usually people, from my lecturing experience, people don't have questions in 2 cases. Or they understood everything, or they did not understood anything. I suppose in first situation, it's you are so good, and second time so bad.
We will have a lot of questions for you at the end. We will have a lot of questions for you at the end.
Okay.
At the end.
Okay.
Yeah.